Before we start the presentation, I'd like to ask you, how do you access your information about the COVID-19 pandemic today? And how did you find health-related information when you were a university student? Our study aims to investigate the information-seeking behavior of Hong Kong healthcare students during COVID-19, with a focus on knowledge, preventive behavior, and risk perception. Public health promoters and the government can target these information sources to disseminate the information towards the students, and then enhance these three aspects. But why healthcare students, and why medical and nursing students in particular? Well, this is because medical and nursing students are the future primary healthcare workers fighting against infectious disease. As a result, targeting them are likely to have the greatest effects in terms of pandemic or epidemic control. And from these students, we received 370 responses in total. So what are our findings? We'd first like to display to you some surprising results that we believe ought to be mentioned and addressed. We asked the respondents some basic questions about COVID-19 in our questionnaire. Surprisingly, a sizable proportion of the respondents got wrong answers, as you can see on the table. Furthermore, if you look at the numbers highlighted in red, a significant number of respondents failed to avoid high-risk events under the COVID-19 pandemic. This might be normal if we're looking at data collected from the general public, but it's not reasonable if we're looking at data collected after the start of the pandemic from medical and nursing students. They should have a general awareness of these infection control measures and should be performing them for their own safety.
Next, as we can see from this graph, social media, online newspapers, and television news are the top 3 most frequently accessed platforms used by our respondents to access information regarding COVID-19. After performing factor analysis, we also discovered that respondents accessing information from official and online information sources weekly or daily perform more preventive behaviors than those doing so monthly or even less frequently. Hence, promoting health-related information can increase preventive behavior. Moreover, we also found that preventive behavior correlates positively with risk perception, in particular behaviors related to cleaning, contact, and droplet precautions. Let's quickly recap all the information given in our presentation. From our study, we found a surprisingly high rate of incorrect answers to the quiz questions. Therefore, public health promoters and government should focus on education through the top 3 sources of information among medical and nursing students. This is because more frequent use of information sources is associated with more preventive behavior. In particular, crucial information such as transmission routes and incubation period of COVID-19 should be emphasized. As medical students practice more preventive behaviors, they can serve as frontline role models who will eventually influence the same among their future patients, and therefore help to prevent future epidemics. We sincerely hope that our research can stimulate more health communication with a focus on social media, online media, and television news. Thank you.